Chronic kidney disease is characterized by the progressive and irreversible decline in glomerular filtration rate over time.
Chronic hypertension leads to arterial wall thickening and stenosis, significantly reducing the blood supply to the renal parenchyma.
Prolonged high pressure within the capillaries results in glomerulosclerosis, destroying the kidney's ability to filter metabolic waste. The accumulation of fibrous tissue in the interstitium causes tubular atrophy, further compromising the kidney's structural integrity. When the filtration barrier is compromised, large proteins like albumin leak into the urine. As filtration fails, nitrogenous waste products accumulate in the blood, leading to the clinical syndrome of uremia.
Damaged renal tissue also reduces the production of erythropoietin, often resulting in secondary chronic anemia.
Renal failure disrupts the balance of calcium and phosphate, leading to secondary hyperparathyroidism and bone mineral disorders. Progression to end-stage renal disease necessitates life-sustaining interventions, such as hemodialysis or a kidney transplant.